Hey, we're back. I wanted to talk to you about some breast implants again, but a little bit more specific. I was hanging out with some girlfriends this weekend. Well, let me clarify. I was hanging out with some friends that happen to be girls, and they kept asking me some questions that I'd heard before, good questions, and I realized that these are the same questions that people are always asking, and there are a bunch of myths regarding breast implants, and I wanted to debunk all of those myths today. And in case if you're wondering what this is I got stuck at PHPS neon sign. If you come in and take a picture in front of that, and then post it to Instagram and tag us, get a little discount on your injectables, but I digress. Anyway, so the five myths I wanted to talk about regarding breast implants are: one, do they cause cancer? Two, do you have to change them out every 10 years? Three, do you need to get only shaped or teardrop implants so that your breast implants will look natural? And four, can you breastfeed after getting breast implants? And number five, will the silicone implants, will they leak into your body? So let's go through each of those myths right now, and so I can debunk them. So first off, will breast implants cause breast cancer? So the type of breast cancer you're probably thinking of that you hear about on the news and things like that, as far as the BRCA gene or ductal carcinoma or lobular carcinoma, the typical types of breast cancer. Breast implants do not cause that type of breast cancer. The one type of cancer that breast implants are linked to is not the typical cancer. It's more of a lymphoma. It's called anaplastic large cell lymphoma, which is an overgrowth of like lymphatic tissue. And so there's certain types of implants, specifically textured implants, that can lead to ALCL, anaplastic large cell lymphoma. It's a very, very low risk. Again, it's just really with textured implants, and it's really only with one particular brand that I don't even use. So with your typical breast cancer, they don't cause that type of breast cancer, but they are linked to a certain type of lymphoma, anaplastic large cell lymphoma, and that is just in the scar tissue around the implant. So regardless of what type of implant you get, whether it's saline or silicone, everybody develops this scar tissue around the implant. That's pretty normal. But if the scar tissue gets really thick and distorts the breast, that's called capsular contracture. And if the scar tissue turns into that lymphatic lymphoma type of tissue I was talking about, anaplastic large cell lymphoma, then the way to treat that is go in and cut out that scar tissue that's causing that lymphoma, and you take that out, and that actually cures the patient. If you are worried about having anaplastic large cell lymphoma after getting a textured implant, the way you would know that is a couple years after the augmentation, you would get this swelling of fluid around the implant, and you would notice all of a sudden you get this swelling on one side, not the other. Your doctor can pull that fluid out, send it to the lab, they can test it, and they can tell whether you have anaplastic large cell lymphoma, and then the way they treat that again is go in and cut out that scar tissue. So that's the breast cancer issue, that myth. So it doesn't really cause that typical type of breast cancer. Secondly, do you have to change it out every 10 years? Well, there was a study several years ago with older type of implants that showed that after 10 years, 20% of patients have to get their implants changed out, whether because it was leaking or because they got that scar tissue that led to capsular contracture. So for whatever reason, 20% of patients had to get some sort of breast augmentation revision after 10 years. That means that 80% of the patients were totally fine. So that's a myth that you have to get it changed out after 10 years. If you're doing fine with the implants, you have no problems with them, you have no concerns about them, you can leave them in as long as you want. Do not have to get them changed out every 10 years. As far as the most natural look of implant, people think that maybe you have to get a teardrop implant or a shaped implant so that it's fuller at the bottom, not so full at the top. That's the only way to have a natural looking breast augmentation. That does help. But the other way you can get just a natural breast augmentation is not get a huge implant. Everybody thinks you have to go big or go home. That's not true. If you get a smallish round implant, 200, 250 cc's, and of course this will change depending on your height, but if you get a relatively small round implant, you'll have a very natural looking breast augmentation. You don't have to do a huge implant, and you don't necessarily have to do shape just to look natural. As far as breastfeeding, if you're theoretically able to breastfeed before a breast augmentation, you'll be able to breastfeed after an augmentation. So don't worry, when we do breast implants, you don't automatically have to worry about that you can't breastfeed. That's just not the case. The way we put in the implant, we don't interrupt the breast ducts going, the milk ducts going up to the nipple. They're not interrupted with breast augmentation, so you should be able to breastfeed afterwards if you were able to breastfeed before. And then lastly, as far as leaking silicone into your body, one of the studies that's been done is that natural scar tissue that forms for everybody around saline or silicone implants, the scar tissue again is normal. If it gets thick and distorts the breast, that's capsular contracture, or in very, very, very minimal number of cases, if that scar tissue turns into lymphatic tissue or lymphoma, that's ALCL. Okay, again, I just want to make sure everything's clear here. But as far as that capsule, that scar tissue, that naturally forms around the implant, even if your implant leaks, First of all, the implants nowadays are pretty much all gummy bear implants if you're doing silicone. So if they have a crack in the implant, they don't just spill everywhere. They're not a liquid. But even if there was a crack, an opening in the implant, and that gel was starting to seep out, that capsule keeps everything inside. So the silicone doesn't actually leak outside of that capsule. So you don't have to worry about leaking out into your body. Now, the things I'm telling you about these 5 myths that are debunked, this is true information. It's accurate information. It's based on the currently available information. Now, you may read something different in a comment on a YouTube video, but you have to take those kinds of comments with a grain of salt. So I'm telling you the truth. I'm telling you accurate information based on the current available information. But again, if you hear something different or you read something different, take a look at the source, and I would definitely recommend not believing everything you read in comments on videos. Anyway, hope that was helpful. Please let us know if you have any other questions, and we'll be happy to make a video about that and post it here. And also, if you are watching us on YouTube, please subscribe to our channel. And if you're watching us on Instagram, please like and follow. Thanks a lot.